Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thanks for joining us once again. You know, people being treated for cancer and cancer survivors are among those at risk for serious illness from coronavirus. Now, that's because cancer treatments weaken the immune system, especially for those who are currently getting chemotherapy. Now, here on Health Professional Radio to explain what people with cancer and their caregivers need to know during this time is Dr. Lisa Richardson. She's director of CDC's Division of Cancer Prevention and Control. Welcome to Health Professional Radio, Dr. Richardson. Thanks for joining us.
Thanks for having me.
Why are people with cancer and cancer survivors at a bit higher risk of getting really sick from COVID-19?
Well, that's because people with cancer and survivors, especially those getting treated with chemotherapy, are at a higher risk for infection because the treatments we give can kill the white cells that fight infection, and they're more likely to get an infection and more likely to have a severe outcome.
What about detecting COVID-19 in someone who's currently getting chemotherapy? Isn't that going to affect some of the testing?
It may or may not. The fever, if you're getting chemotherapy, you should be tested for all types of things that can cause an infection, bacteria, other viruses. So it is a signal that your body is trying to fight something off. And if you're getting treated and your immune system is weak, you need to see your provider, call them right away.
Is there any information out there concerning cancer patients that is kind of mythical? You know, we hear a lot of misinformation, especially now, you know, there's lots of telemedicine. There are a lot of phone calls being made, lots of texts and emails. You're already dealing with cancer and chemotherapy, and you're listening to what's going on in the news, your family members, your caregivers. What are some of the myths that we need to clear up where COVID-19 is concerned in cancer?
Well, I think one thing that we have to be aware of is that anybody can get the infection, right? If you have cancer, the chances are more likely that you're going to get it and more likely that you're going to have a poor outcome. Some of the things that you mentioned, telehealth, which is excellent. If you're doing it with your provider, a lot of people have moved towards having telephone visits or Skype or Zoom, those types of things. And those visits are, obviously you can't touch a person when they're on Zoom, but you can still talk with them and figure out what's going on with their symptoms. If you're getting treated for cancer, it's up to, your provider as to whether you will continue that. It seems that most people who are already getting treated are continuing. And people with new diagnoses may have slowed down a bit because doctors aren't doing the surgeries at the same rate that they were before. But I hear that's coming back online again with surgeries.
Do you find that in your experience, cancer patients, you say most are electing to continue with their treatments, and some physicians have stopped some of the surgeries? Have there been any instances where it was advised to stop your chemotherapy because of any other conditions that you may have had in addition to the cancer?
Not that I'm aware of. I mean, I'm a medical oncologist by training, so if someone has other problems, all of those things are taken into account when you're figuring out what to do with the cancer treatment, but I haven't heard that myself, no.
Are there any suggestions about some of the cancer treatments being at least to some degree effective against a COVID-19 infection in someone that's got cancer?
No, I'm not aware of that because it's a virus, and I would assume that the drugs are treating the cancer cells and, not necessarily the virus. I think there have been some clinical trials out there where they've noticed that this may work because of the virus it is, but not that I'm aware of.
Now, as far as caregivers, what is it that you'd like to tell people who are caring for people with cancer who may suspect or be in fear that COVID-19 may become an issue?
So what they should do if they test positive, or as you said, they think they might have it, or their provider thinks they may have it, even without testing, is that they should separate themselves from the person with cancer, because, as I said, they could get it quicker, more easily. If possible, to stay away, isolate themselves within the home, or just not come there to where the cancer patient is, and may even want to have somebody else come into the home to take care of them during the time that they're quarantined or infected.
Are there certain types of chemotherapy that can be done in home?
So one of the, most, I think 95% of people who get treated for cancer now, it all happens in the outpatient clinic, not in the hospital.
Okay.
But to answer your question specifically, there are quite a few oral drugs, like drugs you can take by mouth, just a pill, that a lot of people can take, and they don't have to go in to see the doctor, and that's their usual treatment anyway. So those should continue, uninterrupted if they're taking pills for the cancer.
When your caregiver becomes ill and maybe you're not, what about some of the options for people, switching caregivers? What about some of the fears of going into the home where a caregiver has been infected, but the person in there still needs their crucial care?
Yeah, and that the advice that I would give, if at all possible, is to have someone else come in to help take care of that person. Because you really don't, if you have COVID and you have a family member or someone else with cancer that they're being treated for it, you just really need to be extremely careful that you don't transmit it to them.
Where can we get CDC information to help folks with cancer and their caregivers, especially now during the COVID-19 pandemic?
So the best place to go for COVID information is to cdc.gov/coronavirus. And for those getting chemotherapy, there's another website that we recommend, preventcancerinfections.org.
Well, I thank you, Dr. Richardson, for joining us here on Health Professional Radio this morning.
Okay, thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.